I'm Elaine Balutis. I am an orthopedic surgeon who is hand and upper extremity trained. Before coming to work at MaineGeneral, I was in my training, so I went to medical school at University of Massachusetts. That was followed by an orthopedic residency at Mount Sinai St. Luke's Roosevelt in Manhattan. And then I did my hand and upper extremity training at University of California, Irvine.
Hi, my name is Mark Spencer. I'm one of the hand surgeons here at MaineGeneral. I went to medical school at the University of South Carolina, School of Medicine, Greenville. After that, I did orthopedic surgery residency at the University of Connecticut. And then following that, another year of specialized training in hand surgery in Dallas, Texas at University of Texas Southwestern.
As a hand and upper extremity surgeon, I really do what it says, all the way from the fingertips to the elbow. We do any soft tissue work, nerve work, trauma, sports-related injuries, even kids with some congenital deformities we can take care of here.
Hand surgery includes surgery on the fingers, the hand, the wrist. It involves surgeries on bones, tendons, ligaments, and joints. We see things as simple as trigger finger releases to more complex trauma cases. And that's one of the benefits, I think, of hand surgery is that we treat all different populations, both elective surgeries and more trauma, time-sensitive surgeries, and we can treat all those folks that come to us here.
I think my philosophy of care is really understanding the patient and working with them as a team. Obviously, there can be a lot of book answers for some things, but what really matters is what the patient wants, what they need, and what they think is best for them as well. So I love giving patients as much information that they can have to then make a great informed decision, and they can feel comfortable asking me any questions, and together we can hopefully come up with what's the right answer for them, even if that answer changes as they go through the process.
My goal in treating patients is to give everyone high quality, compassionate care. My goal is not to see as many patients as possible in the office every day, not to sign everyone up for surgery, but to inform them, to educate them, and then give them all the treatment options moving forward and let them ultimately make the decision. We have nearly all aspects of orthopedic care covered with a provider here at the hospital. So you can essentially get all your care that you would need for orthopedics here under one roof, which is helpful. We collaborate with other services as well, which is great for patient care. From a hand surgery perspective, we have 3 surgeons here currently, so we can frequently bounce ideas off each other if there is a more difficult case or interesting case, and we'll discuss amongst ourselves what's the best plan moving forward. Unique things about MaineGeneral here is our ability to do in-office-based procedures, which folks really do like. And we have an outpatient surgery center where we do the vast majority of our elective orthopedic hand surgery cases.
I think MaineGeneral is just an amazing place for the community and even from people outside of the community. We offer just top-notch care from some of the best doctors around the country who have chosen to live and work here themselves because they love it so much. I really think we can provide anything that the rest of the state has to offer, just hopefully for people in the community so they don't have to travel far, but can also feel comfortable being with us.
I think one of the most satisfying things about practicing hand surgery here at MaineGeneral is the follow-up of the patients that I get to treat. Not everyone, of course, but vast majority of folks come back either after surgery or after a couple office visits, and they are extremely grateful for their care. They're happy with their outcome, and I feel like Mainers in general will tell you kind of their thoughts, and they're not going to hide it. And so a lot of those thoughts that they express to us are very beneficial.
I want to be a doctor, a surgeon that people can trust and feel comfortable coming to. Again, even if they don't choose for me to be their surgeon, at least they can come ask questions and just maybe I can help them along with their journey for whatever is troubling them. I think that's a part of just being here in this community is really being a resource, an ally, a friend, and a surgeon to anyone that lives in this area.